I really enjoyed talking to the patient and seeing how positive being involved in research had been for them. And I think before that I was a little bit afraid of research, and I was a little bit worried about sort of patient involvement. But I could really see from this patient how valuable it had been to him to be involved in the research, how he was part of a group for patient involvement, and how giving that opportunity for people to be involved in studies and both for the, might be beneficial both for themselves and for future patients, and how positive some of the patients felt about that.
There is a famous quote, I can't remember who it is exactly, that about, without research, eventually everything just stagnates. And I think the advantage to patients is you've got people who are, around them, who are inquiring, who are relatively up to date. Patients they often have an opportunity to get involved in research themselves, which may be of benefit to them, or more typically to fellow patients or patients' children or whatever. So I think that's a thing, and I think probably the actual outcomes are being cared for by people who are are interested in pursuing outcomes, finding out what best practice is. I think those are the advantages, really.
The benefits to patients are that they're involved in the most cutting edge of medical science, that they get the best possible treatments, that is evidence-based, and that as an organisation we are seen as leading that forefront of the medical science.
I absolutely implicitly believe that research active organisations have better outcomes for patients, and that message is probably the key driver for staff being engaged with care and with research in their care. I think that the reason that it makes such a difference to have research active members of staff is it promotes a whole questioning attitude to what they do in their day jobs. And making research integral to clinical care is very important in improving those outcomes, I think.